You actually don't necessarily need to see a vascular surgeon for cancer chemotherapy. You need to really follow up with your oncologist or your cancer surgeon, who will therefore manage your entire management. What happens is, oftentimes cancer patients require medications that are required to be given through into the big veins. These are given through something called portacats. These portacats allow you to get these toxic, strong medications through this so that it doesn't burn the rest of your blood vessels in the arm. For this to be done, you typically will need to see a vascular surgeon who will put this in a fashion that typically requires local anesthesia, doesn't require you to stay in the hospital, and is done in collaboration with your cancer doctor. As I'd mentioned, what happens is that you put a large catheter inside your big vein that allows them to put the medication directly into this big vein, so that there's no chance of it eroding or corroding the smaller blood vessels that are up here. And it allows the medication to go in a painless way into your system. Portacats are typically inserted as outpatients. Or as same-day surgeries. You will come, get it done, go home, and the follow-up for all of this is typically done by the oncology or the cancer nurses where you will be getting the chemotherapy. This is a question that really is determined by the nature of the cancer that you have, and it has to really be determined by your cancer surgeon or your cancer oncologist, because they will decide how long, as well as how long before and after you will need it. And so they will decide therefore when it's needed. When you go to the vascular surgeon, it will be at the behest or at the suggestion of your oncologist or your oncosurgeon, who will say, I'd like for this person to be started on chemotherapy at this time, and subsequently, prior to doing that, we will get the portacat in. You will come to the hospital. The nurses will make sure that they've identified the correct procedure in the correct patient, do the necessary paperwork, including taking a consent from you, knowing the risks, benefits, alternatives, and complications. After all this has been agreed upon, they'll take you to the operating room. You'll be put on the operating room table, given a little bit of sedation just to make you comfortable and take away the anxiety. They will turn the face to the other side, again in a way that you're not strained. They will clean this whole portion. You will have a small little cut made here into which a pocket, which is the portacath, will be put into, which is about the size of a quarter, that goes inside there. And you'll see after that that there'll be a small bump over there that will be noticeable, but it will be all underneath the skin. The only thing that you'll have will be a cut that will be about 4 to 5 centimeters in length, and that will heal up through stitches that are absorbable. And the rest of the catheter is all on the inside. So there will be nothing visible on the outside except a little bit of a bump over here, which typically is below the collarbone so that it's not visible. This way people do not have to feel shy about going outside. At the same time, they're able to have their chemotherapy done in a simple way. The important thing is the quality of life should be maintained without compromising, even if somebody has cancer. As far as the wound and everything is concerned, it typically will take about 2 weeks for it to completely heal up in terms of the small cut that's been made. After that, the port has to be taken care of, which you will follow up with the nurses in the chemotherapy unit, who will regularly flush it and be able to make sure that appropriate measures are taken so that there's no chance of developing an infection in this. And that is what they're trained for. That's why going to specialized centers for each of these steps is really critical.